Welcome to Avanto Training. In this training session, we're going to help you better understand the industry. Have you ever wondered what America looked like before the Affordable Care Act? Today, many Americans lack adequate health coverage. The poor disproportionately lacked adequate coverage. There was wide variation among states. Insurance costs were outpacing income increases. Limits on coverage and discrimination. In this video, we're going to take a look at the qualifications and characteristics of qualified ACA plans. Fair health insurance premiums, no higher for women than men. Guaranteed availability of coverage. Prohibition of pre-existing condition exclusions or other discrimination based on health status. Prohibiting discrimination against individual participants and beneficiaries based on health status. Non-discrimination in healthcare. Comprehensive health insurance coverage. Prohibition on excessive waiting periods. Preservation of right to maintain existing coverage. Let's talk about essential health benefits. Ambulatory and medical visits, urgent care services, hospital, maternity and well-care baby, mental health, substance abuse treatments, medicines, rehabilitation, laboratory services, preventive treatments, pediatrics, vision, dental services. Do you understand everything so far? Great! Our next topic is getting to know more about the ACA mandates. There are two kinds of mandates, individual and employer mandate. What is an ACA individual mandate? The individual mandate is the unofficial name for the requirement to obtain coverage under the Affordable Care Act. That requirement is part of the Affordable Care Act's shared responsibility provision. The fee in this provision is officially called an individual shared responsibility payment. The mandate's concept that all eligible Americans have at least basic health coverage or pay a tax was originally proposed by the Heritage Foundation in 1989. Here's what you may not know. How much is the penalty fee for not having coverage? The ACA fee for not having health insurance for each month you go without coverage is either a flat dollar amount or a percentage of income above the tax filing threshold. Keeping that in mind, the fee increases every year. Do you have any idea who is eligible for ACA? Who? Citizens or naturalized individual or legal resident have special visa or meet special migratory conditions. Who is not? Those eligible for Medicaid, Medicare, Indian tribes, veterans, employers, illegal residents, those in jail, and special exemptions. Individuals that qualify must buy a plan. It's important for you to know this because next we're going to talk about subsidies, because individuals may get help from the government. The ACA's subsidies are available to individuals with incomes between 100 to 400% of the FPL or federal poverty level. For those making less than 100% FPL, they may qualify for medical if their state expanded Medicaid. How is FPL calculated? Take your time and view this table to find out. Next, let's talk about ACA mandates for employers. The ACA's employer mandate states that all business with 50 or more full-time equivalent employees must provide health coverage to at least 95% of their full-time employees and dependents up to age 26 or pay a fee. What happens in this new administration? Despite having a new administration, the ACA is still in effect until further notice. That means 2017 open enrollment is still the only time to shop for 2017 coverage and get cost assistance. The law may get repealed in full, but that is unlikely, and thus, the full price tag below is unlikely. Instead, it's more likely that some provisions will be repealed and replaced. Trump has previously stated his intention to replace or reform the law, and after being elected, he restated that he plans to keep key provisions. However, keep in mind that established laws are not that easy to repeal. The process of replacing the Affordable Care Act with any alternative could still last many months and possibly years. In this regard, we must talk about these complicated procedures. The new political leaders can repeal significant portions through a budget procedure that avoids a Senate filibuster and allows them to pass it on to a party line vote. But they cannot repeal all of it that way. And if they were to replace ACA, that's even harder. They would need 60 votes, including opposing parties' members, to overcome a filibuster. Is everything clear so far? Okay. Now are you ready to take the quiz? Let's start. Remember, you'll need a minimum of 90% passing score to advance to the next section.